On today's World Insight, more than 20 million infections and counting, with more than 730,000 deaths. What will it take to take a bite out of the coronavirus spread? How bad can the pandemic get? And a Russian-developed COVID-19 vaccine out of the pipeline. How effective can it be? Is it the breakthrough needed to turn the tide against the pandemic?
We believe it's very important to be fair, and different countries need to have access to the vaccine.
Here's our host, Tian Wei.
Hello and welcome to World Insight, coming to you live on CGTN. I'm Tian Wei in Beijing. Confirmed COVID-19 cases worldwide have topped 20 million, with more than 730,000 people dead. This is the latest information. And the U.S. still tops the list with more than 5 million, a quarter of the global cases. The number jumped from 4 to 5 million in 17 days. It means the U.S. has more COVID-19 cases than Ireland has people. Some countries in Asia and Europe had to deal with a second wave of infections, while Africa and Latin America are also trying to slow down the spread. Faced with the grim milestone, the World Health Organization chief urged all governments and citizens to act now.
Behind these statistics, there is a great deal of pain and suffering, and that this is a difficult moment for the world. But I want to be clear, there are green shoots of hope, and no matter where a country, a region, a city or a town is, it's never too late to turn the outbreak around. There are two essential elements to addressing the pandemic effectively. Leaders must step up to take action, and citizens need to embrace new measures.
For more on the COVID-19 pandemic worldwide, particularly in North America, we are joined in Providence, Dr. Megan Rani, an emergency physician of Brown University. In Boston, Dr. Ali Rajat, Executive Vice Chair of the Massachusetts General Hospital. In Boston, we have Dr. Abar Karan, who is the Harvard Medical School, coming from there. And also in Lancaster, Dr. Mohammed Munir, a virologist of Lancaster University. Gentlemen and lady, welcome to the program. I know the number are still counting. All of us feel extremely heavy about that fact. Now, let me ask you, Dr. Rani, you and I have been talking on and off for a long time, starting from March. Now, Dr. Rani, do you think the awareness about prevention and control, at least in the United States now, have been changing?
That's a tough question. I think that people are trying to figure out what the right thing to do is. Unfortunately, we still lack a consistent national message around prevention and control. So it's really still on a state-by-state basis. As COVID-19 spreads, as we have new hotspots in new states, many states' leadership are stepping up and creating mask mandates, emphasizing the importance of social distancing, and creating state-specific testing programs. But we really do still lack that national level public health messaging that would make such a difference.
I see a lot of messages are being, in fact, delegated from the federal level to the state level, and probably even to a small institution such like a school itself to decide what to do. Dr. Raja, tell me about whether that is the best approach for now.
That level of delegation just doesn't work with a country as diverse and spread out as the U.S. There really needs to be a centralized message. As you can imagine, we have not just states with differing messages, but as you pointed out, regions, cities, and in some cases school districts that are operating differently. My town here in Massachusetts is operating differently than the neighboring town, but we all live in such close proximity that what it means is that COVID spreads more easily when we don't have a consistent message around the entire country.
That is extremely important, as we have seen cases after cases about how important a consensus at this point for saving lives. Dr. Karan, I also want to have your opinion as well. We see that resources is hard to come by, not only for doctors' PPEs, which Dr. Rani had been fighting a long time to come, I remember right, but also for resources for people who need to have relief funds and support during this time, and this is crucial also for their health. Dr. Karan, how do you see this overall structure of support provided to people, at least where you are in Boston and also in the U.S., of course?
Absolutely. This is such a critical point. So as we sort of look back at different measures of lockdowns that were implemented, we know that not everybody was able to stay at home, especially those people who were more poor, who were frontline workers working much lower wage jobs. They didn't have the PPE that they needed. They didn't have the protection that they needed. And so as we sort of move forward now, we have to realize that as we ask people to stay home in certain counties where there's very high levels of transmission, myself and others believe that that is likely to be what is needed to really curb transmission quickly. Now, if you ask people to stay home to help to reduce the spread, you have to make sure that they have the financial protections that they need to do that. And so that's very critical because, as you know, over time, there are obviously hardships that are placed on people, both financially, psychologically, emotionally, and we have to do this better this next time around as much as we can.
In the United States, as far as I know, there has been several rounds of, quarantine, but maybe not necessarily done it completely, and therefore, once it opened, it goes back to the earlier situation, probably even worse, from 4 million to 5 million, 17 days only, though the earlier from 0 to 1 million, it takes quite a number of months. So it sees that change. Dr. Munir, you're joining us from Lancaster. Of course, situation inside Europe and various countries can be a little bit different, but tell me about your current challenges.
Well, I think one thing is very important to pass across is that the lockdown doesn't really eliminate the infections. What it does is just put a control on, and as soon as we put the lift off and social behavior changes, that the virus will get the chance to come back into the community. And that's what probably we are seeing here in the Europe, that many countries now, from Belgium, Germany, Spain, even in the UK, we have like 5-6 regions on the local lockdown. So that is the situation we are seeing here, and that is particularly, again, to emphasize that everybody is still susceptible to infection. On a large scale speaking, 80 to 90% people are still uninfected. This virus still has a chance to come back and infect at the scale that we have seen in March, April before.
Right. We see a lot of moving factors as we speak, ladies and gentlemen, about the prevention, control, testing, treatment, and also vaccines. Latest news, later we're going to show our exclusive interview with the Russia Investment Fund CEO talking about their support to the Russian vaccine today in the pipeline, going to a third stage trial. But we see vaccines. Some say good news, by the end of this winter, probably we're going to have something. But whether they're effective or not, we don't know. But we also hear from others that it's going to be a devastating situation because winter's going to come. We're going to have probably a much worse situation than we already witnessed in the world, particularly in some of the heavily inflicted countries of the pandemic. So, Dr. Ramni, tell me about your assessment now, given what you witness every day on the front line.
So we're certainly concerned for the fall. Many of us feel that we've honestly frittered away the summer. We put those lockdowns in place to quote unquote flatten the curve, to get those cases down to a manageable level so that we could set up those public health measures to tamp down hotspots before they got flared up too much. Unfortunately, here in the United States, we have not effectively put those controlment measures in place. We still don't have good testing. We still don't have good contact tracing. We still don't have adequate supplies of personal protective equipment. At Get Us PPE, we're still seeing rising numbers of healthcare facilities asking for PPE to be donated because they can't get it and can't afford it. We're quite concerned for the fall. You know, Dr. Raja and I both work in emergency departments. We know that in the fall and winter, we're overwhelmed by patients with respiratory viruses, even in a normal year. This year, when those folks come in with RSV, with flu, we're going to have to treat each of them as if it's COVID. It's all going to mix together, and it's going to create a really dangerous and overwhelming situation for those of us in the northern climates. It didn't have to be this way. There's still a little bit of time for us to catch up if we can put good public health measures in place, but it's quite concerning for those of us that do work on the front lines.
Dr. Raja, listening to your colleague, Dr. Rani, you've been waving your head, suggesting you're unbelievable, unbelieving in a way of the current situation. But Dr. Raja, what does it take for people to take note of science does make sense, right? I mean, prevention and control measures, once you do it, it helps. And also, nobody can give your life unless yourself cherish it. I mean, these are basic common sense, but the public now is very confused.
You are absolutely right. A lot of this involves personal responsibility. Now, as a country, we in the U.S. it was built on personal responsibility, right. But now it also involves building and taking responsibility for those around you. So, for example, a lot of the surge in cases that we're seeing right now is younger patients, people in their 20s, people in their young 30s, and they're young and they're healthy and they think, this can't happen to me, so I'm going to go to the beach, I'm going to go to the swimming pool, I'm going to go and have lunch with my friends without wearing a mask and sitting very close to each other because they think that they're young and they're immune, but they don't think of their parents and the older population, those young patients who are also sick and have asthma and other breathing problems. It involves solving this is going to require taking responsibility not just for ourselves, but for everybody in our community.
This is having such a huge impact on our human society. I mean, we can work from home, but how long can we separate ourselves from all the other human beings? We are social animals. Yet we have to control ourselves and doing the personal responsibility part, hoping that the others would do the same. Dr. Karan, can we do a better job about that? Can we bring more people on board? This is really about life.
Absolutely. I think the unified response is really what's most important. So I'll point out New Zealand as an example. Recently in the New England Journal of Medicine, there was an article published looking at New Zealand's response, and I was very impressed seeing Jacinda Ardern mention that she saw their response as a team of 5 million. Now that really stuck out to me because we need a more unified response nationally in the United States. We need more people to see this as a national effort that we're all in together, all states are in together, that crosses political divisions, and that we all have the same goal, which is to reduce community transmission so we can get back to the lives that we so cherish. I think the other key part here is to really look closely at what is happening at the community level and understanding the dynamics of transmission at a community level, because different communities in the U.S. socialize in different ways. So where spread is happening in different places will be different. And it's key to figure that out quickly so we can target our public health response and messaging accordingly.
But can you right now compete with all of those either fake news or fake information? Even the president of your country today at a press conference talking about, the great influenza ending World War II, which of course very different from what the reality was like in history. So can you, public health individuals like you guys be able to compete against all of this? Dr. Rani.
We have no choice but to keep pushing forward, sticking to science.
Yes. Also, Dr. Rani, please.
Yes, I absolutely think that we can compete. It's certainly a little more difficult when we don't have a cohesive national message, but you can see numerous examples across COVID of ways in which we as public health professionals have stood up for the right thing and have helped mobilize and inform the public. Again, it's more difficult, but it's not impossible. And as my colleague at Harvard just mentioned, we have some information now that helps us. So for instance, some of us are working specifically with churches to allow churches to find a way to congregate, to worship, to honor their faith, but also to keep them safe. Similarly for kids, many of us are working with schools, school nurses, school districts, superintendents, to try to figure out best possible ways to allow kids to learn while also respecting public health needs. My own university here at Brown has developed a comprehensive plan for responding to our local levels of COVID while keeping our students safe, and at the same time helping to drive our local response and to enhance our local public health measures, because our city knows that that's essential to getting our college students back.
Right.
So it's really, we have to work in different ways. It's more grassroots. It's not through the traditional forms of government, but it's absolutely possible. It just takes conviction and it takes community working together.
Right. I know, Dr. Rani, you have to run, going to your next assignment once again, so I want to thank you for now, but I want to keep all the other gentlemen with us to continue this conversation, because Dr. Raja and Dr. Karan in your United States, Dr. Munir later, we're going to handle the European situation too, you know, and, but Dr. Raja and Dr. Karan, tell me more about how, you know, as frontline doctors and medical workers, to less complicated issue, but you're going to see until the end of this year a political election in your country, and COVID-19 is already being politicized to the huge extent. And then there's also geopolitics. You see countries trying to throw in accusations toward one another, particularly with this White House. So, Dr. Raja, how can we understand and how can you fight back about those?
It's a great question, and one that we are having to deal with and have had to deal with for the past few months. But as you point out, in an election year in our country, this will it will tend to become more divisive rather than less. That's the nature of democratic elections. What we can do is we can keep coming back to the science. It's really easy, not just nationally, but as you mentioned, geopolitically, to focus on competition and races. The announcement earlier today from Russian President Vladimir Putin that they have the first approved vaccine is notable and noteworthy. However, it's important to know that we have to rely on the science and the fact that it has not yet undergone phase 3 clinical trials, much like there are vaccines undergoing phase 3 clinical trials in the US and the UK already. It's important not to make this about competition and a race, but about developing an efficacious vaccine, no matter who gets it first.
Right.
And so in this country, what we're going to have to do is come back to the science rather than trying to make it about competition.
According to WHO, of course, just a footnote, there were six before the Russian announced their latest discoveries, 6 vaccine candidates that have been going into third stage trial that have been looking at as very promising. Of course, there's likely to be another one added by Russia going to third stage trial. Having said that, there is a vaccine nationalism, and that just like remdesivir, 80% of them have been bought by the United States, while the rest of the world are wondering, you know, what to do next for us. But these are geopolitics and politics that you can see, Dr. Karan. My question to you once again, how you as individual public health workers try to work your way out and bring the people around you together at this very complicated environment.
Yeah, that's a great question, and the key here is that as much as we have separate epidemics in different countries, at the end of the day, we all live on the same planet. As long as virus is circulating in different countries, people will travel. We live in a very globalized world, and so unless we get this down, the transmission down in all countries eventually, this virus will continue to pop up and rear its head up over and over again in all places. And so it's so important that when we do get a vaccine that has gone through phase 3 trials, is proven efficacious and is safe, that it is distributed efficiently and equitably. And I really want to highlight equitably, because at the end of the day, we cannot let finances and privilege and power drive who gets the vaccine. We need to make sure that everyone in our societies across all countries, especially those who are poor and vulnerable, have access to this vaccine. We know that the COVID transmission rate in all countries is so much higher in crowded situations, especially in people who are very poor and vulnerable. So it's so key that we get the vaccine there.
You know, the virus does not read the GDP numbers, and the virus does not read as to which society and class one person is coming from. One person has it, the world still has it. So that's just loud and clear, this message. However, Dr. Munir, thank you for your patience listening to your colleagues coming from the United States talking about their latest situation. I want to bring you in. I mean, this is the time when people say international cooperation. How can we have a better time for international cooperation? This is a common enemy. It's not human. It's a virus. And let's work together on all the fronts. But it's not happening. It's not happening efficiently right now. Dr. Munir, your prescription.
Well, I think if we really look on to different perspective, of course, there has been a different level of cooperation in different sectors. But I mean, specifically talking about vaccines, although outliers are always identified, I think we have seen a great level of cooperation between different governments, between World Health Organization and the private sectors. For instance, SAPI fund so many good technologies to bring that one up, and not only working on the technology itself, but also looking onto small-scale details like the last vials that are required to pack up the vaccines. So certainly there has been a great level of cooperation, but of course these are the things that can always be improved, and we have seen to some instance some competition and the race, as we've been highlighting before with the Russian vaccine and similar kind of other vaccines, moving forward with sort of more race, so competing for each other than against the virus. But there is always a room for increased collaboration, and we have seen relatively weaker response of the World Health Organization, particularly taking the USA perspective out. So there is certainly a need for international overshadowing of this whole scenario, that in future, if this situation would come, we will have somebody who will really take the lead into establishing collaboration between different institutions.
It seems that the WHO is still having its daily press conference regarding COVID-19 every day. U.S. still on the top of the list, but the U.S. has decided to withdraw from the WHO. That's at least a work being considered as milestone by this current administration inside the White House. We have to put their internal politics aside, but internationally that's going to cost us heavily, I mean all of us, because the United States is still one of those very important countries in the world, and international cooperation really does require everybody to play a role. I don't want to drag us into geopolitics, because none of you, it is not fair to let you to deal with those. It's not your job. It's politicians' job. They better do a good job about it. So before we go, I do want to ask you about a issue in your field. That is, what can we rely on from now on, as we speak, to deal with possibly another round of a bigger outbreak as winter comes? And how can we best prepare for the biggest challenge still to come later this year, early next year? Dr. Munir, briefly from you first.
I think this pandemic has laid out quite strong foundations that we can really build on and count on for future collaboration. Certainly we need a global leadership, not only at the political side, but also at the scientific side, and also better preparedness for the future to come. Particularly in the countries those are more vulnerable with weaker healthcare system and weaker research infrastructure, and probably focusing a little more onto the transparency and openness into reporting any case that is emerging around the world, because earlier we have it, better we would be equipped to really tackle that.
Dr. Karan.
So the key, especially looking at the United States, is we need to reduce the level of community transmission as quickly as possible, because as we head into winter, we are going to be indoors far more where we know the virus spreads more easily. Once we do that, and once we get community transmission to a low level, which for what that may take is some sort of a smarter version of lockdowns in high transmission counties. Once we do that, we have to stick to the public health basics, testing, tracing, isolating, and making sure that we wear masks. And that we social distance as much as possible, and that we have a unified response, and that people understand the situations that lead to transmission and avoid those. And that's going to be so key before we head into the winter.
Basic steps, so important. Dr. Raja.
I will point out, all the points made thus far are exactly right. I will point out that we do have our experience with the first surge. Back in late February and March, when we were starting to see these cases, healthcare workers, my teams of doctors and nurses were terrified because we didn't know if whatever measures we put in place, if we would be safe. Now we know that with good PPE, with strong precautions, maintaining social distancing as much as possible, even in the hospital, we can keep our patients and, just as importantly, our staff safe and healthy. I was terrified a few months ago that half of my staff would be sick and not able to come into work. Now at least we have the hospital procedures in place to treat patients with COVID safely, which will definitely help us with the upcoming second surge.
There are things that we can do. Let's just do it quickly so that we can save lives. Thank you so much, the three of you, gentlemen, Dr. Ali Raja, Dr. Abra Karan, and Dr. Muhammad Munir. Earlier appreciation to Dr. Megan Raleigh, who joined us earlier. Thank you so much for being with us. Be safe. You're watching World Inside with me, Tian Wei. Still to come on our program. A Russian developed the COVID-19 vaccine out of the pipeline. How effective can it be? Is it going to be the breakthrough needed to turn the tide against the pandemic? Some answers from someone directly involved in the work right after the break. Welcome back. You're still watching World Inside with me, Tian Wei. The first Russian-produced COVID-19 vaccine developed by Moscow's Gamaleya Institute received regulatory approval from the Russian Health Ministry. President Vladimir Putin said on Tuesday it is the first country to register a vaccine. The Russian president said the vaccine had gone through all the necessary checks and one of his daughters did take it. The speed highlights Russia's determination for an effective product, but has stirred concern from some that it may be putting national prestige before science and safety. Earlier, I talked to Kirill Dmitriev, the CEO of Russian Direct Investment Fund that bankrolled the effort on vaccine efforts and the importance of international cooperation. Here's our exclusive interview. We are joined by Kirill Dmitriev, the CEO of Russia Direct Investment Fund. Kirill, good to see you again.
Yes, good to see you. Thank you for having me.
You have a lot of work these days related to COVID-19, the fight, and also the prevention against it. Tell me more about different fronts, testing, drugs, and vaccines. Some brief information.
Yeah, so basically we focused on three elements of fight against coronavirus. It's very good testing, and our test systems already were sold to 13 million tests outside of Russia. And for example, they're used in all of the Moscow airports because they give very precise results in 30 minutes, which allows to increase existing testing throughput. Also on drugs, we supported a drug called Avifavir that already is used very widely as antiviral against COVID in Russia and has also been bought by 15 other nations. We are going to be launching a website about the vaccine called sputnikvaccine.com, which will share information about vaccine. So we believe today is a very important, very positive news in our joint fight, the fight of the whole humanity against coronavirus, because the first approved vaccine is a very, very important joint human step forward.
The vaccines, many of them, the most important candidates, according to WHO, have been entering into the third stage trial. About the newest one coming from Russia.
Well, we already finished very successfully 2 phases, and following Russian regulation, all of the procedures were met for approval. What's very important is that our approach using adenovirus vector to to deliver the spike of coronavirus have been validated by other people. So, for example, CanSino is using adenovirus number 5, Johnson & Johnson is using adenovirus number 26, and Russia actually is using both adenovirus number 5 and adenovirus number 26. And we believe it's the joint use of those delivery mechanisms that will lead to very good, effective results and long-term immunity. What's also very important is that this approach has been studied by our Gamaleya Institute for the last 6 years. So thousands of people have received this approach before, and the Russia vaccine really focused on safety and efficiency.
But as you may know, Kirill, there are a lot of issues regarding vaccine, complicated process, particularly once an immunity is being developed, how long it will last. That will have a lot of impact on whether a vaccine is successful. So what about the antibodies, the length of antibodies, and also the function of antibodies developed as a result of the vaccine so far?
You're absolutely right, and that is the biggest concern, that the immunity will not last for too long. So our vaccine demonstrated both the antibody response and what's called T-cell response. We believe that for longer immunity, 2 shots are needed, because antibodies could start being reduced very quickly if it's just 1 shot. So we believe it's important to have 2 shots, and it's very important to use 2 different vectors to deliver the shot, because if you use the same vector second time, it's just much less effective second time. So we believe, based on the studies our Gamaleya Institute has done, that Russian vaccine will last for more than 1 year, hopefully 2 years. But of course, we are doing lots of detailed research on the long-lasting effects of the immunity of the vaccine, and that's a key issue, as you said.
It reminds me of some of the research being done around the world about a quote-unquote cocktail of antibodies to address the immunity period problem. Having said that, though, what about the testing of the vaccine? When you go to the third stage trial, of course, you have a lot of positive cases inside Russia that you can work on with. However, how would you make sure that this vaccine could address problems that are existing in different parts of the world? As you may know, some of the virus are coming from different origins.
Yes, exactly. So we are big partners with China. We are big partners with other nations to jointly work on the vaccine, to jointly produce the vaccine. We expect that 5 other nations will be producing Russian vaccine. We will have clinical trials in many nations.
What are these countries?
So we will have clinical trials in United Arab Emirates, Saudi Arabia, Philippines, maybe Brazil. So it will be widely tested around the world. And we believe it's this partnership approach that's very much needed. We really benefited from working very close with China on a number of issues. And we believe that countries need to be together, not divided in this fight. Because of course we want to protect Russian citizens, just as China is protecting Chinese citizens. But we also believe Chinese vaccine, Russian vaccine, other vaccines that are out there are going to be protecting humans. So we believe there will be 5, 7 vaccines by the end of the year available to the world. And it's very important that all of them are developed, tested, and supported.
Right. You talk about the cooperation with China. Can you be, Kirill, a bit more specific? Which area, to what stage already the cooperation is happening? And also, what kind of results can we expect in the near future, the end of the year, as you said?
Well, we definitely benefited from the first days of the pandemic when we were informed by Chinese side about the pandemic. We worked very closely jointly on tests, and jointly with BGI really benefited from our joint cooperation on tests. We received lots of clinical trial research on the Avifavir drug that we later launched in Russia. And on vaccine also there has been lots of exchanges with Chinese scientists and lots of cooperation. So I think we see China cooperation in many aspects of health industry. We believe that China vaccines that are being developed are very good and will have very good results. And I think it's a good example for how countries can work together, support each other, rather than trying to attack each other in this very important fight against COVID. And I wanted to use this analogy that animals, when they go to drink to a water hole, they do not fight and live in peace. I actually looked it up, and it turns out that animals do attack each other on water holes. But hopefully we could be better than animals. We believe that there should be a truce on politics around coronavirus, truth on politics around vaccine development, and we should all work on those vaccines, all of the nations, to really save our people.
Do you see the role of WHO in this regard and international cooperation, various platforms?
Well, definitely, and information about Russian vaccine has been provided to WHO, and we are sharing information about our vaccine on our site, which is sputnikvaccine.com. I'm publishing an op-ed today about the vaccines that was not published in most of the Western media publications. So we want to publish information about Russian vaccine and have people learn and know. So I think it's very important to cooperate with all of the bodies that are out there. I think those bodies need to be respectful of scientific research, of accomplishments of different scientists. We have great academician Ginsburg and his also deputy, Mr. Loganov, who developed these vaccines. They're great scientists. And I think it's important that we support our great scientists in different countries.
Contrast probably to a lot of countries, we have noticed that the United States have been playing geopolitical card even in the middle of the pandemic. For example, the Secretary of Health's visit to Taiwan, which is supposed to be a very sensitive issue between China and the United States. Now, I don't want to concentrate on geopolitics in this conversation with you, because I know you are investing in a lot of scientific research projects. So tell me about how important it is now to play with the fire of politics and geopolitics when we have lives on the line.
Well, I think it's very important that it's very clear that people of all of the nations in the world want to have a vaccine, want to be safe, and want to have protection. And I think it's very important to separate people from some of the politicians who really are focused on divisions and focused on attacking. But once again, we will publish our research in all of the scientific key publications in August. We believe that nations should work together so data will be shared. And we believe that artificial barriers to knowledge or really unfair competition is just negative for the world. And I think we've seen too many examples of attempts to do unfair competition, to tarnish reputation of Russian vaccine, of Chinese vaccine recently. And those are very negative steps. I think they are not moving us forward in the fight against COVID.
What do you make of trying to suggest that there is kind of a supply to one country or certain groups of one country first before it should be available to the other countries, whether they are the ones that invented the vaccine or they are the ones that have been supporting to invent the vaccine? What do you make of these kind of arguments?
Well, we believe that vaccines should be shared very widely. I think it's very important, and as you know, we will be producing in 5 nations. Those nations will be producing for themselves and for other nations. We received inquiry from 20 nations. We are working on some humanitarian aid projects with some of our partners in the poorest countries. But I think it's very important that vaccine is distributed broadly, that different countries have access to it. And we showed this example with Avifavir, our drug. So we produced it in Russia, but we also delivered it to 15 other nations. So I think capability to deliver to the world quickly is very important. And in contrast, for example, 90% of Remdesivir, the US drug, has been purchased by the US. So other countries are really left out, not being able to purchase the drug. We believe it's very important to be fair, and different countries need to have access to the vaccine. And we are working very hard on this. We know China is as well.
Production is a very important component of this whole chain of issues. How to make sure that production is already happening before we have the final candidates for the successful vaccine is a mind-boggling issue, and who to work with for the production, how production can be transported efficiently to different parts of the world without, limits of geopolitics and others. These are mind-boggling questions, much going beyond the scientific research. Kirill.
Yeah, well, we are focused on a very practical approach. So first of all, we will be producing in Russia with 2 of our portfolio companies called R-Farm and Allium. And secondly, we are building those partnerships with different countries in the world to produce. We already reached agreement with a number of those nations. We would be open to also produce in China. And I think those production capabilities are important. So we already are producing Russian vaccine. Russian people will start getting vaccinated already in August, with a massive vaccination starting in October. And you're absolutely right that production is a big component, and we are open to partnership with different nations to produce Russian vaccine. We're also open to produce vaccine from some other nations as well.
It is not just about testing the drugs and the vaccines. It's also about prevention and control at a time when there are a lot of uncertainties. So, Kirill, Russia had been under test about its capability for prevention control this time since COVID-19 broke out. Where is it to go next?
Well, I think you are right that social distancing and wearing masks are very important. And actually, Russia was acting very toughly on this, also using some of the methodologies that China developed. So we're actually able to prevent the major outbreak, and Moscow mayor has been very tough on COVID with very strong social restriction measures. And I think we are moving to the world where it doesn't make sense to put people on social quarantine at home, but it does make sense to keep distance, it does make sense to wear masks, and it does make sense to be careful, particularly indoors. So I think it's a combination of tests, drugs, vaccine, and social distancing measures, but without quarantine so that economic activity can resume.
Kirill Dmitriev, the CEO of Russia Direct Investment Fund, what a pleasure. All the best to the vaccines you are working on.
Thank you very much.
Thank you. And that's all the time we have for today. If you'd like to see more, you can certainly search our program, World Insight, or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei. On behalf of the team, thanks for watching. Bye for now.